And then after I had the fall, the day I had the fall, my daughter then, Kerry, she rang up straight away. And I think it was that day.
It came through to us.
Sandy come straight up, and then everything started rolling from there then.
Yeah.
Sandy, when I had the carers in, because I was just stuck here, I couldn't do anything. I was in a mess, wasn't I? I was in a big mess.
Julia had no aids in the property and was suffering with extreme anxiety. So I looked at the immediate issues and problems due to her living on her own. She told me that her husband had passed away last year, and although her family were local, she wasn't sure how she was going to manage. I'd done a referral to our occupational therapist in the community resource team, but I knew there was a bit of a waiting list. However, we did manage to get an OT out.
I'm Kelly Williams. I'm Managing Better caseworker for Bridgend County. I supported Julie following a referral from Sandy Davis, Rehabilitation Officer. Went out to see her initially to address minor adaptations and other general items such as benefits and a healthy homes check. We processed a grant for an accessible tablet. We looked at benefits and helped with some application forms. Part of the healthy homes check, I identified that her boiler wasn't working as it should, and given her health conditions like arthritis, sight loss, we processed a boiler application for that to be replaced. We looked at Welsh Water to get her water reduced, warm home discount, and also a grant for lighting in the kitchen, concrete path, galvanised rail and grab rails to rear access. Myself and Sandy Davis completed a joint visit shortly after my initial visit, and we addressed items such as bus pass application, additional benefit forms. During my visits with Julie, we looked at employment and support allowance, personal independence payment, but we also looked at increasing her current benefits. The RNIB grant that we applied for, it was a joint application between myself and Sandy. Sandy was able to write a letter of support which supported the application, where Julie had an iPad awarded to her. She's become less isolated and she loves to shop on eBay. The grant processed for Julie for adaptations was for highlight steps to rear access, 3 grab rails, concrete pathway, external handrail and LED light in the kitchen. That was via Enable funding, and the total cost of that was £330. Later on, supporting Julie, we got involved with Disabled Facilities Grant, and that was for a potential wet room, so a level access shower, and that process is still ongoing. And as a Managing Better caseworker, I'm there to support Julie with all the application and the process of it. That also involves our technical officers, so they manage all the works to ensure it goes smoothly, and they survey the property and put all the plans together. So being a Managing Better caseworker, obviously my trainers allowed me to prescribe grab rails with colour and tonal contrast, and I work very closely with the technical officers to provide information and advice to them on certain eye conditions and how a blue grab rail may look better on white tiles or a black grab rail on white tiles. In relation to the benefit applications I supported Julie with, it worked out to be a weekly increase of £206 a week, and also arrears of just under £800. With the Managing Better service being able to support people with benefit applications, it greatly helped Julie in that she wasn't able to see any of the print. With me as a caseworker not helping her, Julie probably wouldn't be in the situation she is now, in that she's got a regular weekly income which she relies heavily on for taxis or getting to the hospital appointments, which can be quite a lengthy journey.
It frees me up as a ROVI then to do the rehabilitation, taking Julie out, orientation and mobility, getting her on buses, because she now got a bus pass. Get her out, getting her into clubs and classes and support groups.
When I lost my husband and then I was off sick, I lost all his pension, his state pension, his private pension, it all went. So the only money I had coming in was my pay from work, and lucky I worked for the council and I was earning a good wage, and I had full pay for 6 months, and then I went down to half pay, and lucky enough I didn't have the mortgage because my house is all paid for and that, so I was lucky in that sense. I didn't have that to worry about as well. But then when it went down to half pay, I was sort of worrying a bit, thinking, oh, I hope my benefits do get sorted, because how am I going to, I'm not going to be able to afford to live, because I thought my half a pay is not even going to cover my food and electric and gas and things like, you know, so I wouldn't have had enough to live. But when my benefits come then, it's bumped my money back up, so I was able to function, because I wouldn't have been able to function if I didn't have my benefits. I wouldn't have been able to do anything. I would have been even more isolated, because at least with my benefits then I go to Sandville, I pay my £5 to have my therapies, and I have a sandwich and a raffle, and we go in the charity shop down there and that. You know, I don't do extravagant things. I mean, like someone, when I do decorating and stuff with the bit that I got, I go on eBay and I find the bargains, and I go in the charity shops. But I'm able to do that, but I couldn't have done if I didn't have had my money made up, no.